Welcome back. So if you are sick right now, you are not alone. There are all sorts of viruses going around right now. And this morning, we are joined by Baptist Health Dr. John Allen Cockerell with the Sherwood Family Medical Center. Good morning, Dr. Cockerell.
Good morning.
So we just talked about it a little bit. Flu, COVID, RSV. Which are you seeing more of right now?
Well, really, we're seeing all of them. So in terms of distribution, more, it may vary from clinic to clinic, right? But we definitely have seen a lot of COVID and flu, right? RSV is definitely out there as well, particularly in the young children. That's the ones that we're most concerned about with RSV and the older adults. But we've seen quite a bit of all of them. I mean, 'tis the season. Here we go into respiratory season.
So what are the big differences between flu, COVID, and RSV?
Right, and we could probably spend some time here. I know we don't have a whole lot, but I will say this, there are some overlap, there is overlap between these three. Flu, you're looking at the big three, at least in my mind, right? So that's fever, that's 100.4 degrees or higher, right? So true fever, cough, severe myalgia, muscle pains, those things, right? RSV, especially in young kids, is marked by more respiratory distress, so shortness of breath. Distress even meaning not just cough, but sometimes we can see heavy breathing, shallow breathing, even retractions, which means the ribs are kind of pushing in somewhat, right? So respiratory distress, big deal with RSV. For COVID, hey, this is, going into year, 4 of this, right? I mean, it continues to kind of blend with other diseases. So, but you can see upper respiratory, so significant headaches, sore throat, and then also the cough aspect, the lower respiratory. Fatigue is a big one with COVID, right? So, and that can even linger. And I'm sure if you've had that out there, you can realize that. But those are some key features. I think the big thing is figuring out or trying to figure out which one this is in order so we can treat it.
So what happens when you take a test for COVID or flu test and it's neither?
Right. So I get paired with that a lot, actually, right? I have a sore throat and a cough. What do I have? Right? It's like a puzzle.
And you're like, oh my God, is it COVID?
Right. So sometimes it does test negative, and those can be, false negative tests, right? But just assuming those are true tests, there are several other viruses out there that can mimic some of these symptoms, right? If we did a real, drill down into it, we could find what that virus subtype is. But a lot of times for clinical purposes, we just treat empirically, meaning that we try to help you supportive care, support your body through it. We may not get an actual virus name, right? But we know that in that realm of viruses, we can still help.
Okay. Well, Dr. Cockerell, thank you so much for your time this morning. And if you have any questions for him, please contact Baptist Health by going to Baptist-health.com. You see the number right there. We will be right back with more on Daybreak.